He went to bed like any other night, and never woke up. Did you hear about the 71-year-old man who passed away in his sleep last night? No prior health issues, no signs of struggle, just a quiet evening, and he never woke up. His family was stunned, but here's the real question. Could it have been prevented? Imagine this. You kiss your loved one goodnight, and by morning, they're gone, without a sound, without a warning. It's not a nightmare, it's something that happens more often than we realize. The truth is, once we cross the age of 70, our bodies change in ways we don't always notice. What used to feel normal might silently become risky. And I'm not just talking about chronic conditions or hospital visits. I'm talking about small habits we do every night without thinking. Habits that may seem harmless, but over time, can increase our risk of heart attacks, strokes, or even sudden death in our sleep. And most of us would never suspect these quiet dangers. That's why in this video, we're going to explore 4 nighttime habits that older adults commonly practice, often unknowingly, that may be putting their health at serious risk. If you or someone you love is over 70, this might be the most important message you'll hear today. So stay with me, because understanding what's really happening while you sleep could be the first step toward protecting your heart, your brain, and your life. Let me ask you something. When was the last time you had a big dinner right before bed? Maybe some rich pasta, fried chicken, or a heavy bowl of chili? It might have felt comforting, but what if I told you that same comfort could be quietly hurting your heart? After the age of 70, our bodies don't handle food the way they used to. Metabolism slows down, digestion becomes less efficient. What we once ate at 9 p.m. without blinking can now throw our entire system off balance. And one of the most overlooked dangers? Eating large meals too close to bedtime. Here's what happens. Instead of your body winding down for deep, restorative sleep, it's stuck working overtime, digesting. Your stomach produces more acid, your intestines stay active, and your heart rate stays higher than it should. That internal busyness keeps you in lighter, more restless sleep stages. And over time, this doesn't just lead to poor sleep, it opens the door to much more serious risks: heart attacks, strokes, even aspiration pneumonia caused by acid reflux creeping up while you lie down. Ever woken up in the middle of the night with heartburn? Or a racing heart for no clear reason? That's not just age, it could be your dinner. And for those living with diabetes, it's even riskier. A heavy late-night meal can spike your blood sugar during sleep, throwing off your entire system and increasing the long-term risk of metabolic disease and cardiovascular events. According to a study by the Mayo Clinic, late-night eating has been linked to increased risk of hypertension and cardiac events in older adults. But here's the good news. This is something we can control. Experts recommend finishing your last full meal about 3 to 4 hours before you go to bed. That gives your body time to digest properly. And if you do feel a little hungry before sleep, don't worry. A small, light snack, like a handful of almonds, a banana slice, or a warm cup of herbal tea, can actually help you rest without straining your digestive system. If you've ever gone to bed full and woken up groggy or anxious, your body may be trying to tell you something. Remember, your body has changed, and your evening habits should too. Something as simple as shifting your dinner time a little earlier could mean waking up tomorrow feeling clearer, calmer, and even adding healthy years to your life. But food isn't the only hidden threat. What if something as simple as drinking water was affecting your heart while you sleep? Let's talk about that next. We've all heard it, stay hydrated. And it's true, drinking enough water is essential for your health. But here's a question that might surprise you. Can too much water, especially at night, be harmful? If you're over 70 and find yourself waking up multiple times each night to go to the bathroom, you're not alone. And no, it's not just a sign of getting older. It could be a warning that your bedtime hydration habits need to change. As we age, our bladder doesn't hold liquid the way it used to. The muscles weaken, and our kidneys continue filtering fluids even while we sleep. That means if you're drinking a full glass of water, juice, or tea before bed, you're almost guaranteed to wake up in the middle of the night with an urgent need to go. And while that may seem like just a minor inconvenience, the risks are real. Imagine this. It's 2 a.m. You're half asleep. And suddenly you feel the need to rush to the bathroom. But when you stand up too quickly, your blood pressure hasn't had time to adjust. That drop in blood pressure, called postural hypotension, can cause dizziness, lightheadedness, and in many cases, dangerous falls. It's one of the leading causes of nighttime injuries among older adults. And it doesn't stop there. Every time you wake up and turn on a light, your brain gets tricked into thinking it's morning. That disrupts your melatonin production, the hormone that helps you fall into deep, healing sleep. Over time, this constant interruption can weaken your immune system, raise your blood pressure, and even accelerate memory loss or cognitive decline. One recent study from Harvard Medical School showed that seniors who frequently wake during the night have a 26% higher risk of developing dementia symptoms. So, what's the solution? You don't need to stop drinking water. In fact, staying hydrated during the day is still one of the best things you can do for your heart, your brain, and your energy levels. But timing matters. Try to drink most of your fluids earlier in the day, and gradually taper off by late afternoon. If you feel thirsty in the evening, take small sips instead of drinking a full glass. And be mindful of hidden sources of liquid, soups, juicy fruits, or even some medications can all add up. Also, steer clear of caffeinated drinks like coffee or black tea after 4 p.m. Caffeine is a diuretic. It makes your body lose water faster, increasing your chances of nighttime trips to the bathroom. If you've ever felt exhausted in the morning despite sleeping 7 or 8 hours, your nighttime hydration may be to blame. A few small changes to your evening routine can make a world of difference. Better sleep, fewer bathroom trips, lower fall risk, and a sharper mind tomorrow. Let me ask, how warm is your bedroom at night? If you're like many people, especially as we get older, you might like to feel cozy and bundled up before sleep. A toasty room, thick blankets, and flannel pajamas might seem comforting, but for seniors, sleeping in a room that's too warm could be silently harming your health. Here's why it matters. As we age, our bodies naturally lose the ability to regulate temperature as effectively. We don't sweat as easily. Our circulation changes, and our core temperature doesn't adjust as quickly as it once did. That means even a slightly warm room can quickly lead to overheating, especially while we sleep. And overheating at night isn't just uncomfortable, it can be dangerous. When your body becomes too warm during sleep, your heart has to work harder to cool you down. This added strain can raise your heart rate, cause dehydration, and most importantly, prevent you from reaching the deep, restorative sleep your body needs. A 2021 study from the National Sleep Foundation reported that seniors sleeping in rooms warmer than 72 degrees Fahrenheit had a 31% increase in nighttime wakefulness and a 20% higher risk of cardiovascular strain. Let me tell you about Frank. He's 74, retired, and loves reading in bed. He keeps his room around 75 degrees Fahrenheit and piles on heavy blankets. But night after night, Frank wakes up sweaty, restless, and completely drained in the morning. What he doesn't realize is that his sleeping environment is putting stress on his body every single night. So what can we do about it? Experts recommend keeping your bedroom temperature between 60 and 67 degrees Fahrenheit. That might feel cool at first, but it helps your body naturally drop its core temperature, which is essential for deep sleep. Instead of heavy blankets, go for lightweight, breathable bedding. Think cotton or bamboo fabrics. Wear moisture-wicking sleepwear. And if you can, crack a window or use a small fan to keep the air circulating. Fresh air not only keeps the room cool, it can also reduce breathing issues caused by stale indoor air. Better sleep starts with the right environment, and for many, that begins with a simple change on the thermostat. Let's talk about something you probably don't think much about, your sleeping position. You might assume that as long as you're comfortable, everything's fine, but the truth is, how you sleep could be silently affecting your heart, your breathing, and even your brain health. And it's one of the most overlooked risks for people over 70. As we age, our body's structure and systems shift. Muscle tone decreases, lung function becomes less efficient, and circulation slows down. So the way we position ourselves during sleep, something we used to do without thinking, suddenly has a bigger impact than we realize. Let's start with a common one: sleeping on your back. It might seem natural, even relaxing, but for many older adults, lying flat on your back allows your tongue and soft tissues in your throat to fall backward. This can partially block your airway, a condition known as sleep apnea. Often undiagnosed, sleep apnea causes repeated interruptions in breathing throughout the night. That leads to oxygen drops, poor sleep quality, and increased strain on your heart. Over time, this can contribute to high blood pressure, heart disease, and even sudden cardiac events during sleep. Then there's sleeping on your right side. That might seem harmless too, but studies have shown that it can put subtle pressure on the heart, especially for people already dealing with heart conditions. Over time, this positioning may worsen issues like fluid buildup in the lungs or legs, leading to a condition called congestive heart failure. One study from the Journal of Clinical Sleep Medicine found that patients with heart failure had significantly better oxygen saturation and sleep efficiency when sleeping on their left side compared to the right. So, what's the best position for heart health and overall well-being? Sleep on your left side. Here's why. It supports better circulation, allowing blood to flow more freely throughout the body. It reduces pressure on your heart, giving it less resistance while pumping. It helps prevent acid reflux, which is especially helpful if you've ever felt that burning sensation creeping up your chest at night. Worried about rolling over in your sleep? You're not alone. A simple solution is to use a body pillow to help keep you in place. Or place a pillow between your knees for better spinal alignment and lower back comfort. You can also slightly elevate your head with a supportive pillow to keep your airways open and reduce snoring or breathing interruptions. If you've been waking up tired, groggy, or short of breath, don't ignore your sleep position. It could be silently affecting your heart and lungs every night. This might seem like a small change, but it's one with big rewards: better sleep, healthier breathing, and less stress on your heart. So tonight, as you tuck yourself in, take a moment to check how you're lying. That small shift to your left side could be one of the most powerful things you do for your health, starting tonight. Let's take a moment to step back and reflect. We've just walked through 4 seemingly simple bedtime habits that many of us do without even thinking. But after the age of 70, these habits can quietly become harmful. They can affect the quality of your sleep, strain your heart, and even increase the risk of serious health events. Let's recap. 1. Eating heavy meals too late at night. Your digestion slows as you age, and late eating can trigger acid reflux, blood sugar spikes, and poor sleep. 2. Drinking too much fluid before bed. This leads to nighttime bathroom trips, increased fall risk, and disrupted sleep cycles. 3. Sleeping in a room that's too warm. Your body needs to cool down to sleep well. Overheating stresses the heart and increases the risk of dehydration. 4. Sleeping in the wrong position, especially on your back or right side, can affect your breathing, circulation, and heart function. These may not sound like major threats, but over time, they can have a profound impact on your heart, brain, and overall longevity. The good news? None of these habits require medication, surgery, or major effort to fix. Just awareness and small, mindful changes starting tonight. So here's my challenge for you. Pick just one small adjustment. Whether that means finishing dinner a little earlier, lowering your thermostat before bed, drinking your water earlier in the day, or shifting to your left side when you sleep. Try it tonight and tomorrow morning. Write down how you feel. Track it for a few days. You might discover that one change tonight leads to many better days ahead. Because better sleep isn't just about feeling rested, it's about protecting your health, preserving your independence, and waking up to more good days ahead. Thank you for joining me on this journey. If this video brought you value, leave a comment below and share one change you're planning to make. We'd love to hear your story. And if you haven't already, don't forget to like, subscribe, and turn on notifications so you never miss another video that could help improve your life. Here's to sleeping smarter and living longer. You've heard the habits. Now it's your turn. Which one will you change tonight? Leave it below. Your story might inspire someone else.